I am Rodrigo Rivera from LINNC Online, and this is a special edition about women in interventional radiology around the world. Today we will talk with Dr. Dorothea Altschul from USA. She's the Director of Neuroendovascular Surgery at the Valley Hospital and Neurosurgeons of New Jersey. She's also Assistant Editor at the Journal of Neurointerventional Surgery and Fellow of the American Heart Association and Society of Vascular and Interventional Neurology. So welcome, Dr. Altschul, to this interview.
Thank you, Rodrigo. I really appreciate the invitation to be here. Thank you.
You wrote a very nice editorial for Journal of Neurointerventional Surgery in 2021. And in that editorial, you said that you learned how to become an interventional neurologist by following the men's path, their rules and behavior. So how different has become the way women are seeing, living or developing this specialty nowadays?
This is I believe, a very difficult specialty, and I don't quote exactly, but I think John F. Kennedy said, we don't go to the moon because it's easy. We go there because it's hard. And regardless whether you're a woman or a man, it's a very hard field. But the difference is that women are not expected to be in a hard field versus men are. So when the men started to do this really hard thing called neurointervention, because this is also a new field, it was developed based on how men think and how they talk, with their language, with their goals in mind. And all of a sudden, when there was a woman there, the language had to change a little bit, because usually men talk a little differently when there is a woman in the room. And I think it is a process for both men and women to learn how to do this really hard thing together, because this is a very, very difficult specialty. This is not glamorous. This is extremely difficult. And so that's how I see this. And I think if there are more women in this field, then we will learn faster together. I believe so.
Nowadays, are there more women? How many women are now in USA, or you feel in the world?
I think so. Yeah, I know of probably around 400 in the world. There's actually a group of women neurointerventionalists on WhatsApp, and I believe they're close to 400.
That's great. That's a big number, but still you are a percentage. I think like 15% around that.
Probably less, probably between 8 and 10%.
Okay. So pregnancy and radiation as a specialty with radiation seems to be a barrier for many women to enter this field. What have you lived and learned about this in your own experience?
Yeah, so I think that anxiety of, having a adverse effect from pregnancy related to the baby is probably a minimal risk, because as a neurointerventionist, we are farther away, and we can double lead and we can protect ourselves. And there was, some data out there that the radiation to the baby is very minimal. But there's, I think, also a mental stress to the woman when they have to do hard procedures and be pregnant. So there's some data that women in surgery have more difficulty with pregnancy, getting pregnant, and then also potentially losing the pregnancy. So I think that's something that is very unfortunate, and the systems are not set up, at least in the US. I don't know how it is in Europe, to help the woman with those kind of issues.
How do you feel in your experience when leaving for pregnancy and duty? Have you feel that you lost a space in that moment? You lost skills in those months away, or that once it wasn't your case?
So I worked until 40 weeks pregnant. I did not stop working. And then I was away for my first two kids, 8 weeks, and for my third kid, 10 weeks. So I don't feel like I lost a lot of skill because it was a relatively short period of time that I was away.
So what about new technologies? Because the robot technology may be helpful in radiation dose or expose. So what do you think about that?
Yeah, I can't wait for the robot to come. I think we all are very interested in the robot, both from like decreasing radiation, but also access to other centers, and also for quality of life, to be able to do it wherever you are and not have to travel. So I think that is going to be huge. Absolutely looking forward to that.
And now you've become a role model for many other women in this field. What is the importance of being the same gender as the role model?
I do think that women have slightly different issues than men, of course, and if they don't have anyone to go to and to ask questions, they may feel, like an outsider. They may feel like it's too difficult to do, and then they don't want to pursue it anymore. So having women who have done it is something that I think is very inspiring to younger women, to have a pathway created, because it's not only that there are other women doing it, but it also creates a pathway where centers are more willing to hire women, centers or training more women. And so I think that's another a benefit of having role models that are female.
So nowadays, society still put to women a lot of pressure in certain roles, as a child rearing or home care. If you add to this, that you said, this is a very difficult specialty, and with the increasing stress. So what happened to women in that situation? What happened to you?
That's a good question. So I think, yes, this is very difficult. I think that as a woman, currently as it is, because of societal pressures where a woman should be, you really, really, really have to want it. If you're not 110% passionate about this, and there are some men who are not 110% passionate, but if you're not 110% passionate, you're not going to succeed in this field, because it's hard. And then having the extra pressures of, child rearing and being a mother, raising kids, the systems need to change so that that part is easier. Because right now it's really, really hard, particularly in the US, where we don't have a lot of protected time off. And we don't have a lot of support from the government to do what we love doing. And so right now, I think it's the only way to do it is to really be sure that this is what you want. Otherwise, I think it's really hard.
Do you have time for telling these things to women that are going through the specialty, or maybe going in like an intern, or around your service?
Yeah, so I have a lot of women reaching out to me. They're asking a lot of questions. They want to engage. At one time I get the phone call from a woman I've never known, and she said, I'm calling you because one of the male doctors said that you are the only woman who knows how to handle 10 men in a room. And I want to know what you're doing. So I'm like, ooh, me. So it was really funny. But yeah, it happens all the time. Yeah.
Do you think that the women they're at more risk for burnout in this specialty or other
Yeah.
ones?
Yeah, absolutely. Women have, and this is in the US, I don't know if this is the same elsewhere, but women currently, women have not been raised to be just professionals. They do have more responsibilities when it comes to children and household. And therefore, I think there are a lot of different compartments in the brain that needs attention. And this is, I think, harder to do. And so it's easier for them to be burned out. I do believe that.
What strengths have women for facing the specialty or patients or what do you think it's the strength of being a woman?
I think the women have a connected knowing. Just like I said before, that women have different roles, they are used to play different roles all the time in their lives. And so when they think about patients, they think about, not just the issue, like I need to put that stent here, but they think about more of the whole entire patient, the whole journey. Where did they come from? Where are they going? They're more connected with a lot of different aspects of health, of taking care of patients, I think, than men are, perhaps. I don't say that I don't want to generalize. I think both people have, strengths and weaknesses in the same way, but in general, I think that's what the women are a little bit different in their way they're thinking about problems.
So what changes are needed to make women more prone to enter this specialty? Example, labor hours, flexibility, salary equality. What do you think about
Yeah,
the things?
all of that. Yes, I think we are just in the beginnings of framing what is needed. But I think most importantly, what is needed is that the problems are stated very clearly, and the women also identify very clearly what they need. Because I think men are very easier, they know what they need, and they say, this is what I need, and it's very clear. And women are not so clear. And when you're not clear, then the system doesn't know how to help you. You know what I mean? So then it's like, what does she want? What is it that you want? And then the framework is not there to really help women. So I think women need to be very clear as to what they want, what makes them not burn out, what do they need to be successful, and the system that's currently in place needs to listen to that. And then I think it's going to be good.
So I love the way you ended the editorial of that in 2021. You ended saying that you should train a woman and she would make you proud. And well, I love that. So what do you think about that?
Because I think if you give someone a chance in something that's hard, as I said before, and they do it well, then it becomes an unexpected but beautiful result, I think. And because women have to often work harder to impress, you know, the people around them. And I think this field attracts very bright people, very bright women. And I would love for places where they're only men to take a chance, you know, to hire a woman. And then I think they will be pleasantly surprised.
Dr. Altschul, thank you very much. Do you want to say some words to finish this interview, some final words?
Well, thanks for having me. I hope, you know, I can serve as an inspiration for other people. And, you know, please reach out anytime if you have any other questions.
Thank you very much, Dr. Altschul. For sure you are and you will be an inspiration for many women seeing this video, and hope to follow your path. Thank you very much.
Thank you.